You never seen before behind the story. After fabricated the denture tools, patient is not happy, which is I really like the great critics. She's right, and then she said it's too long. Something's not right. And the lower dentures, whenever she pushed her tongue, and dentures popped out right away. Of course, we made it 1 year ago. Couple things I would like to talk regarding this case, which is very good. Dr. Young Kim and place implant Dr. Robert Pig in Illinois. Appreciate that. Previously, we made 1 year ago. The step is we set the teeth, denture teeth, and the wax try into the patients before we finalize it. So we did 1 year ago, 6 months ago, and then we did top and bottom is 5 implant, the lower 4 locator over denture cases. And she wear it probably almost 6 months, and she noticed that something's not right.
She kind of length is longer, and then when she bites down, it kind of too much in her mouth.
I have a small mouth, so when I'm trying to chew food, there's already so much in my mouth, I can't keep my mouth shut to chew.
I see.
And then this is a new set, and she feel like it is too wide.
Those are too wide.
And then
Too wide?
Those
Yeah.
are too wide, yeah. And
I mean shape and contour?
yeah, they're too
Okay.
wide.
Got you. This you
Yeah.
cut back this one? Okay, cool.
Yeah.
What else
I
then?
feel like that way I can chew more and I can close my mouth while I'm chewing.
I see.
Because when I chew at the restaurant or something, I have to.
I know. Nobody have to know, right? Gotcha. What else then?
The bottoms.
I see. Cool.
That's
All
why.
right. That's good. She's right. Too long. I thought was the wax try set up and move here, move there. So kind of little different situation. But I think I can handle it because I'm a ceramist and then I know tooth exactly. Removal technician cannot see what patient can tell because two options we can do. We can change the dental tooth, take it out, a lot of work. It's a lot. And then we can reset and then reprocess it. It's a lot of work. Probably 16 hour, 20 hour you have to set up. So this video is very different than any other video which is I made it quite a bit. It's the same things, full mouth implant cases, full mouth implant hybrid acrylic cases, plus with the lower locator cases. The housing, I understand, laboratory finish is black, housing underneath, so which is very loose. So doctor have to choose what they're going to do is blue, pink, or clear. They get more maximum strength, which is we change it here, not a problem. So she got maximum strength is lower, the occlusion is right. So you can see the hours, another art, just like meditators make great shape and contours, make the patients happy, exactly. So whenever you go to the dentist office, you can take a look at it and more and discuss it with the laboratory technicians and also doctors, then you can get the great product. More modify. You see the huge difference, which is the patient's major chief complaint. I want to make it a little bit tiny touch up, but the aesthetic is possible. To me, a little bit wide. This is denture tools from the other claw. You see the differences? Okay. See how big difference? Now I can go to the other side. I'm not trying to cut the fascia much, but most likely more incisor is tilting. So my bottom line is whenever she's smiling, I want to get the good smile from her. Yes. I'm okay to open the incisor in gradual. This is my guidance. Too pointed. Still this one. So before I polish it, I want to test in the mouth one more time. Then I know. Okay, so this one looks like it's pretty good. This is too wide. Especially Denture tools, his issue was they were little set up. It's not like the ceramic. But I'm trying to cut it in a ceramic concept. I think it's good. Let me try that one too. Okay, slowly, go ahead. Okay. Click. A little bit tight. Think all the way down? Nope. What do you think?
A lot better. I can't.
Can you move it? Cool. All right, now
Was good?
what do you think? Still long?
A little bit.
That's fine.
Just a little bit.
Okay, let me see. Yeah,
Just
so
a little
bite
bit?
down.
Okay.
So over bite is maybe just a 1 point, like maybe 1.5. That's too much, right?
That's too much.
Yeah, just
How-
a little bit, yeah.
How's your occlusion contact?
Can I have a articulating there?
No, I think no.
Yeah.
This is now it's okay. It's feel good. I think it's feel good.
Yeah.
Because we have to. Let's do.
A little bit more.
Let's do a little bit more.
Okay.
Let me show you here. Little bit more the top. Did you notice that I make a little bit more feminine looking?
Yeah,
Okay.
nice. Yeah, I can see that nice. So
Now-
you're gonna do later final.
I'm going to do polish. I'm going to a little bit more cut it. Oh, I'm sorry. Okay, thank you. Thank you. Okay.
Yeah. Okay. Bite down. How you feel?
Good.
Good. Okay.
Okay, you can take it again.
Better.
Better. Yeah.
Yes.
You like it? Yeah, I like it's more like your teeth, not like a straight.
It's more natural. It's
Yeah. How about the chewing or something? Bite down.
Also, I have to polish too to make more smooth whenever I
Sure,
grind
yeah.
it. I did not do yet. So
no. I like it a lot better.
it looks like more individual.
Yeah.
So what you can do, Chris, you go to, walk around with a mirror or go to bathroom and take a look at it. Okay. Look right down. Yeah, all nicely bite. Yeah, good.
The bite feels great. Everything. Yes.
Good. Open. Yeah, nice.
I like it.
Yeah, me too.
Much better.
Nice, thank you. Let me try this. No?
I can try.
Try.
Do you feel? Oh yeah, I can feel engaging.
That one is the body preheat. It's pretty good. It's long driver. It's excellent for dentist and laboratory technician.
Yeah.
Mm-hmm. And beautiful and feels natural.
Thank you.
So much better. Yes.
Appreciate it.
Because I'm kind of afraid. Okay, like that. Yes, open. Yeah, bottom. Oh, you have to do it yourself.
There you go.
Like that. Good. It's beautiful. Yeah, I love it.
It even feels, I don't feel like there's so much in my mouth.
Yeah.
Yeah.
It was too big. Oh, I can see more resting.
Yes.
Yes.
Yes. I'm so excited.
That's it. That's the good locator jest. And then we put these high tensions. Okay, put it back.
Too tight.
That's what you want.
Yeah.
So usually what I do, I made the
That's so
indentation.
pretty.
You saw my colors. I
Yeah.
make the narrow down. I make more incisor embrasure open because too wide before and then too tall, so I cut it. So I make good curvature line. Canine was too tall, so I blind it. The lateral is here, and then I make a little bit more indentation between teeth. Looks like young people. When you see the 18 years old, the girl, usually they have a pattern. So I'm trying to recreate the whole rehab concept. That's why patient can get not only that, it's comfortable from the occlusion contact too. You okay with the occlusion contact? That's good. We saw our video, so we finished her the nice smile, which is the 9 implants we done. So I'm so glad Dr. Kim is here, the patient's here. Appreciate you guys consent to the video.
He is the best.
Thank you.
It feels amazing.
Yes.
Thank
it
you.
really does.
This is the what she did.
Wow.
And then she can take it up this and she can get beautiful smile.
Yeah. So this is the gums, right?
Yes, pink.
Pink.
And this is the useful, which is cosmetic. When you see any cosmetic, you never seen before. So whenever you see 6 unit, 4 unit, they want a color, you can take this, and then you never seen before, but you see it in the mouth. White calcification, and here's the elderly people, and the middle age. This is a bleaching, whoever bleaching, so they got that.
Sure.
Yeah.
Okay, good.
After they take it off, the tape later, then
I will
you
use
see
it.
beautiful one. Right?
Okay, thank you so
Thanks
much.
for purchasing.
So every time so when I'm using shade guide, using this one and write this number.
Yes.
Okay.
Yes, it's different number here, number is here. Yep. And then you
Okay.
can capsize it.
Yeah. Thank you so much.
Thank you.
Not autoclave, heavy
You
side.
can do that. You can do that. But I was kind of a little stupid because I spent a lot of money for this.
Yeah, so you don't want
You can do that, no problem.
but
But
one each, whatever using.
yeah,
separate.
this is no problem.
Yeah.
I made a backside a good cylinder. I invented. And then this is no problem autoclave. This is no problem autoclave. But the only thing is I'm worried about is gold.
Oh, sure, yeah.
Still, I mean, so that's why all shade tab was really plastic.
Sure, yeah.
I'm the guy make beautiful. But once you show the patient, have him choose it. Which one do you like? Then you can tell.
Oh, sure. Okay,
Yeah.
great.
Yeah,
Thank
that's
you.
case acceptance,
Yeah.
Thanks for watching my channels. Appreciate you guys support all social media. And then see you next time. Thank you again.